COVID-19 has made life difficult for families. And it has hit those with handicapped children especially hard. Many of them, like kids with Down syndrome, have a weakened immune system and are forced into isolation during the pandemic. But being isolated can have dramatic consequences for kids with special needs. They need social contact to not feel outcast. It's crucial for their development. This is your COVID-19 special. I'm Chris Korber in Berlin. It is good to have you with us. Homeschooling, online classes, e-learning, it's all become a new normal for kids and their families. But the transition from classroom to living room has often been rough, particularly for youngsters who need special care. In India, the problem seems to be particularly pressing, with a recent survey suggesting that because of the pandemic, many of the country's children with disabilities could be dropping out of the education system entirely.
Karthike likes to look closely at the colors of his toy building blocks before he starts playing with them. He can only see, to some extent, large objects and colors. He was born with a neurological disorder, visual impairment, and has troubles with fine motor skills. The 9-year-old studies in the second grade of a government school along with children without disabilities. The school does not provide him with a special educator or the crucial resources he needs to study. As a result, he is almost entirely dependent on his mother for his education. That is challenging enough. Now the shutting down of schools during the COVID lockdown has put him at risk of missing out on formal education entirely.
Compared to other children, disabled children are lagging behind in studies now, even more than before. They're facing many problems. He cannot see properly. What can he understand from a small phone screen? And sometimes there are network issues too, because of which he cannot attend the classes.
The lack of inclusion in the education system for children with disabilities has never been more pronounced than now. According to some recent surveys, majority of students with disabilities are finding it difficult to cope with online education. At the same time, many non-governmental organizations which address the needs of these children and provide them with academic support are also reeling under the impact of COVID-19 and the lockdown. National Association for the Blind in Delhi is one such organization. It helps children with visual impairment and multiple disabilities to build a foundation in learning so that they can later join mainstream schools.
We're not receiving many donations now, so we're not able to pay our staff or provide the facilities for the differently abled children. We've also not been receiving the funds we normally get from the government.
Experts feel that during this pandemic, the special needs of students with disabilities have been completely left out from education policies, which anyway kept them on the sidelines.
Education has shifted to online modes, and systematically we are not ready to cater to the needs of learners with disability particularly. There is, of course, inaccessibility of content in general. The information communication technologies around learners with disability is not very developed in India. And at the same time, there are also issues of non-availability of internet, devices, etc.
Despite all the hardships he faces, Karthike is a lively and happy child. Like other children, he has dreams, one day to be a doctor, another day a singer. The education system owes it to him to be more inclusive.
For more, let's bring in Christine Carman. She's with the United Nations Children's Fund, UNICEF. Welcome to DW, Christine. Give us an idea of the global scope of the pandemic's impact on the lives of children that are already physically and mentally challenged.
Under COVID-19, children everywhere are at a risk, but children with mental and physical disabilities are at a higher risk without mitigating actions, of course. The pandemic, in fact, affects them disproportionately. On the one hand, they may be at higher risk of complications from COVID due to underlying health reasons, and yet at the same time, the information on how to protect themselves from infection may not be in a format they can understand. Additionally, support services, including on health and education, have been suspended. just when the children need them most. And parents who are themselves struggling under the pandemic may not be able to step in, or they may themselves fall ill with COVID. Children with pre-existing vulnerabilities are also least likely to benefit from distance learning solutions when schools are closed. So they are at a risk of falling behind further. And all these factors can lead to increased stress, fears, and a sense of isolation, especially as it may be difficult for them to understand the changes in their lives.
Christine, mental and physical impairment of children are a challenge to them and their families, even under non-pandemic circumstances. Now that the whole world is concerned with not contracting the virus, do the concerns of these kids with special needs go undressed?
The effects of COVID are affecting children disproportionately, as I said before, and the most marginalized children and those in already disadvantaged or vulnerable situations are affected most. So children living in poor communities and poor countries, and girls in particular, children uprooted and living in conflict settings, or children with disabilities. And for some of them, the impact can in fact be lifelong, as the consequences of the pandemic risk plunging them further into hardship or child marriage and child labor. Many children, for example, may never return to school as they have to support their families. And with schools closed, they may also become malnourished because many of them depend on school meals as their only warm meal a day. Similar for children on the move who live in camps or crowded settlements, the situation is particularly difficult. It is nearly impossible for them to protect themselves from the virus, and at the same time they are most likely to be excluded from support and education services or learning programs. So this exacerbates.
What needs to be done then to improve the current situation?
This is an unprecedented crisis which requires unprecedented solidarity, and all of us, governments, the public, the private sector, and donors must work together to keep children healthy, safe, and learning. And a particular focus must be on the most vulnerable and disadvantaged children. So as such, we must ensure that children and communities not only recover from the crisis, but also that they become more resilient for the future. And this requires urgent investments in education, in child protection, in health, in nutrition, in water. And what's also very important is that we listen to children and young people and work alongside them to design a better future and overcome this big crisis and prevent this from becoming a sustained child rights crisis.
Christine Kamen of UNICEF, thank you for your insights.
Thank you.
And now it's over to our science correspondent, Derek Williams, who is hard at work answering your questions about the coronavirus.
How efficient are saliva tests?
Pretty much all of the experts agree that fast, simple, accurate testing is a cornerstone of fighting the spread of COVID-19. But the conventional testing process has some major disadvantages. We've all seen it. A medical professional takes this swab that looks like it's like yay long, and they stick it way down your throat, often via your nose. I haven't been tested myself, but people I know who have been say it's really no fun at all, which is why the news that saliva tests are now being authorized for use is pretty important stuff. Not only because saliva samples are easier to acquire and new methods make them cheaper to process, but also because at some point, at least, you could potentially take the sample yourself and just send it in. And removing the sample takers from the equation doesn't just get rid of a bottleneck, it also means fewer people being potentially exposed. But how accurate are spit tests? Can they compare to conventional swab PCR tests that get it right around 95% of the time? Well, if you trust its developers, the most recent saliva test to gain emergency use authorization in the US is highly accurate. The research team behind it said that their tests agree with benchmark swab tests over 90% of the time. Now, that data hasn't been peer-reviewed, so it still has to hold up to scrutiny. But if it's correct, it could be a real milestone in work aimed at slowing the spread of the disease through really wide-scale, regular testing. Fast, accurate spit tests would, for example, ease our common conscience when it comes to sending kids back to school, because it would help us detect and control outbreaks much faster.
And finally, for every villain, there are heroes to fight them. In the ongoing pandemic, that would be all the healthcare workers battling the coronavirus and helping those affected by it. And how can we show our appreciation for their work? Well, two siblings in California had an idea.
Moved by the dedication of healthcare workers across the country, siblings Prablin and Mantej Lamba decided to give back. The San Francisco area teens launched Cards for COVID Heroes. Working with schools and local scout troops, they quickly collected over 260 cards and sent them to people working on the front lines.
We can just see from their faces that a small note of encouragement with a small $10 gift card can go a long way to encourage them and to help them get through the difficult days they have ahead of them.
While the tech-savvy teens have also created an e-card option, they personally deliver most of the cards to hospitals themselves. On their website, they share their hero's reaction to each little surprise.
During these times of darkness and uncertainty, we just want to try to shine some light on the fact that we do have true heroes working on the front lines who are trying their hardest to save people's lives, and that's all we need right now.